We are continuing with our special pre-budget coverage that we've been doing over the course of the past many days. And today on this edition of Business Plus, we are putting the focus on the healthcare sector. Will Budget 2024 provide a booster dose for healthcare? That's the question we're asking on this edition of Business Plus. Because bear in mind, the healthcare sector is a key important sector for India's growing population. So what can we expect from Budget 2024? What policies are likely to get a push from the central government through the budget? What initiatives and schemes are likely to be launched? And to discuss that, we have a couple of special guests joining us. We have Dr. Kumar Agrawal, National President, Indian Medical Association, joining us. Thank you so much being with us. And we also have Commander Navneet, Bali Group CEO, ClearMedi Healthcare, also joining us. But I'm going to begin with Commander Navneet, Bali Group CEO of ClearMedi Healthcare, joining us at the moment. Sir, the first question is really simple. There is many that you can expect in terms of allocating funds for healthcare sector. There's been only a growth in the budget allocation for healthcare. What would you specifically look for from the upcoming budget in terms of healthcare?
I think democratization of healthcare is the most important factor right now, staring at us. And if COVID-19 has taught us any lesson, I think we need to make full use of it. Focus has to shift to Tier 2, Tier 3 cities. So incentivization of private sector, putting up facilities in Tier 2, Tier 3 cities, I think that should be one of the priorities. The second important thing is I think the government must allocate budget for setting up small e-clinics in villages and towns. And these could be set up by using funds from the government and run by the private sector. Another area which I think we should start looking at is the insurance or the healthcare insurance sector, to give benefits to general public to get into healthcare insurance, and also to look at geriatric, palliative and home care, and this to be covered under the healthcare sector. I think if we look at all these three things, it pretty much covers from primary healthcare to what a lot of us in the towns and cities are sort of going through. And I think it'd be great if government could focus attention towards these. In addition to this, I think as far as cancer is concerned, it's staring us right at the face now. We are growing, having cancer cases come up in a very, very big numbers in all our hospitals across the country. So I think some incentivization towards buying the cancer machines like the linear accelerators, which each one of them costs close to around 20 crores to the private sector. I think this will go a long way to move towards wellness in the future. And looking at, what we are positioned right now.
Right. As we talk about all the important points that you mentioned, it's also important that when it comes to healthcare, the manpower required for healthcare is equally important. And so in that sense, are you expecting an announcement in terms of the number of nursing colleges that are going to be set up? From what we understand, there could be over 150 nursing colleges that could be set up, to staff all the hospitals that we want to have, to staff all the research facilities we want to have. We're going to need all the nurses and the doctors and the paramedical staff that will be crucial.
I think that's a very, very good point that you're mentioning. Not only for India, I think, as we say that we should be making in India as far as, a lot of these goods are concerned, India can also become a place where we train nurses and have nurses not only for us in India, but also for the world. And we become sort of a fountainhead for this trained manpower for the entire world. And in that, direction, I think this would be a great if, more number of nursing colleges and, are set up across the country, because we as a country are rightly positioned. We have a very good, number of, young people in the country. And nursing is now being looked at as a very, very good profession, for many, many, states and towns and villages where girls want to come out and, take up this as a profession. I think we can be that, country which not only, supplies nurses to our own requirements, but also caters for the world.
All right, one important point before we wrap things up, and that is the availability of ICMR labs for research by public and private colleges. You're talking about pandemic and the lessons from the pandemic. We need more research and research to be made available to public and private colleges, isn't it?
Absolutely right. I think if you remember the last budget, also this point was taken up, and we had provisions for setting up ICMR labs and labs across the country. A country which has to become self-sufficient and self-reliant in healthcare in the future has to invest in healthcare, and I think government could focus big time into this. And we are only a little slip away, or away from something of a black swan event in the future in healthcare, and we need to be completely prepared. And I completely agree with you on this.